Is your compliance program truly protecting your growth or just checking boxes? In this episode of The Compliance Advantage, we're joined by returning guest Basia Fit, General Counsel at Emergency Care Partners. With deep M&A experience and a proven track record building scalable compliance programs, Basia shares how forward-thinking legal and compliance strategies can safeguard expansion, build trust with regulators, and give healthcare CEOs a real competitive edge.
Welcome to the Compliance Advantage podcast. This is where healthcare executives transform compliance from a burden into a strategic asset that drives both growth and peace of mind. I'm your host, Ross Ronan, founder of Ronan Healthcare Compliance and a healthcare compliance strategist with nearly 30 years of industry experience. I'll help you stay ahead of evolving regulations while building a sustainable, compliant organization that lets you focus on high-level strategy and exceptional patient outcomes. Remember, compliance pays dividends. Invest today. Welcome to the Compliance Advantage. Today we have Basia Fit, returning guest. Basia, thanks for joining us today.
Thanks for having me back.
So tell us what's been going on between your last episode here and where you're at today. Anything new going on?
A lot of the same, lots of progress on the M&A front, expanding our operations, expanding our compliance department.
Well, good deal. It's a great time to have you on the podcast then. So as we get started, before we talked about kind of a book that's really motivated you, we kind of expanded that a little bit more to say, are there books, mentors, leaders that have really driven the way that you do things as an executive, as a general counsel, anything that's been motivating you to essentially be better and how to lead?
There are many leaders within my organization that motivate me. I see them every day working hard, being responsive to the needs of the company and the needs of other employees. I take example from them and try to strive to be as successful and as available as they are. But one of the books that I read recently that has really resonated with me is 5 Types of Wealth. It was a book that was recommended by one of our physician leaders to me. And it just puts things into perspective that it's not only financial wealth that brings you joy, but it's also other elements such as health and spiritual wealth, time wealth, and social. So I've really enjoyed reading it. It kind of gives you some tasks to think through and assess your life, what you're doing with your time, what you're doing with your friendships, whether on a professional level or on a social level, and to make time for things that really matter. And health applies to all of it, because if you're not healthy, you can't do social activities, you can't work, you can't gain your financial independence. So it's a great book. Highly recommend it to everyone interested in expanding their horizons.
I love this idea about time wealth.
Yes.
Because we've done a lot of reading and a lot of implementation of different time management tools, essentially like Buy Back Your Time from Dan Martell, Run Like Clockwork is another one, a couple of good books that we've used internally as the company, but it really has not only expanded how we look at maximizing our processes within the business. And I think everybody can use that to maximize their structure of how they do work, right? Yes. And how they manage it, which then leads to the ability to have things outside of the company, how to have things outside of work and everyday life so that you could free yourself up.
Yes. One of the examples that really resonated with me was the author was saying, if you have 30 minutes to complete a task, you will complete it in 30 minutes. If you give yourself 4 hours, you will take the entire 4 hours to do it. And society right now has this perception that you always have to be overwhelmed and you have to be busy. And this book kind of reframes it and says, let's be more mindful. Let's set boundaries. Don't check your emails while you're working on projects. It derails you. So great advice and kind of little pointers that he gives to reassess your time management and make time for other things because you've completed your projects.
No, love it. I will pick it up and read. So I appreciate it. All right, let's get into some compliance stuff. I think you've been at Emergency Care Partners for about 6 years now. And in that role, you've had the ability to not only be responsible for general counsel work or the legal work, but also compliance programming, even though after many conversations you and I have had where you've made it adamant that you're not the compliance officer, which I commend you on that, that you do have a compliance officer and a compliance program that's still functioning under ECP. So it's great that you have all of this experience and you really have built quite a great both legal department and compliance department, because I think it came from scratch, really. What is the one misconception that you continually see, whether it's within your own company or within healthcare, as it relates to compliance, related to essentially your board, your CEO, your seasoned executives?
What I hear many times is that compliance is reactive. And that's just not the case. You don't want compliance to be reactive. You want compliance to be proactive, to address, to monitor what you have in place to prevent issues from arising. So, one good example is you don't have an auditing structure within your company for whether it's hospital fees or professional fees generated by physicians, and you have the government knocking at your door during an audit, and during that audit you discover that there is a major billing issue, coding issue. Well, had you been proactive and had you had audits regularly done for your physician groups or the hospital, you could have avoided that. And the government is a lot more forgiving when you report ahead of time versus when they do it on your behalf. That's the main misconception that I see. You want your compliance to be your partner and to implement processes that then help you move forward quicker versus holding you back.
No, it's a great perception on what we see in healthcare, because I see the same thing. And it's a great example on, just to say you have a billing issue, it's overcoding issue, and you have a UPIC audit or you have a TPE or something that has come in. I hear a lot of executive leadership, just want to say, just when it comes in, take care of it, right? I want you as my security blanket, that when something happens, you just take care of things. And that's that reactive part of it. I don't think a lot of people know, especially in the leadership realm of healthcare, that the federal government, the CMS, wants healthcare providers, as part of their commitment to them, as part of their enrollment, to find issues, find overpayments, and return them.
Right.
And then it's just an overpayment, right?
Correct.
And if you don't do that, and you know that you're not doing that, or you're with what is it, willful disregard, or put your blinders on, which is what the False Claims Act says, then you literally turn something that is just give the money back, you got overpaid, to something that could be a False Claims Act violation. Yes. Do you have that conversation with your CEOs and your board frequently?
Yes. And we have a great auditing program within our company, and all the issues are addressed. We are very diligent in making sure our audits are within the standard error rates. And if they're not, we take measures to correct them. And we're fortunate that our CEO, our leadership team, and our board are very open to those discussions and to make sure that we are running our business in a compliant way. I mean, as a physician group, our income comes from professional billing. So if that's not going the right way, we're in trouble. That's our major
You're not getting
source
money
of
anywhere
revenue.
else. Yeah,
exactly. I mean, that can ruin your business very quickly. So we want to address it proactively versus being reactive.
And one of our compliance advantages, pillars, is being preferred partner status. And I think when you talk about being proactive and having an active, let's just say, auditing program, the government, the UPICs, the CMS who's doing the reviews once you are actually in front of the issues and you're reporting your own overpayments and you're already taking care of these issues, and you can sit in front of them and say, hey, we've already addressed it, or we've already addressed these things as a proactive standpoint, the government starts to see you as a preferred partner.
Yes.
And in my own experience, I've had opportunity to sit in front of the OIG and DOJ and CMS. And on the other side of it, they did a look back for many years and said, oh, by the way, you owe us a bunch of money. And we said, okay, this is something that happened like way before my time. And their response was, well, thank God that you guys are a part of this now, because you can fix it. And we know you can because we trust you.
Right.
And so I don't know if you're seeing that type of reaction with your payers and your hospital systems.
We haven't yet, but hospital systems, we respond to RFPs all the time. And one of the questions is, do you have a compliance program? Many smaller groups may not. We have the privilege of answering, yes, we do. We have auditing, we have the hotline, we have reporting, and we have a pretty robust structure. And that's definitely helpful because, I mean, to put bluntly, when the group goes down, so does the hospital.
That's true. That's true.
So we may not have seen it on the government front of being a preferred partner, but it is definitely an advantage dealing with the hospitals.
You know, you as the general counsel have the unique opportunity to both advise the CEO and the board on legal business issues, right? I mean, that's the number one job of a general counsel. That's why the difference between general counsel and compliance officers, right? We get to deal regulatory, you know, this is what the guardrails, and you get to go, this is what you should do from a business standpoint. So I'm sure you're able to have that kind of conversation with your executive leadership to go, look, this is truly a business advantage that we see here, and it's a legal business advantage.
Absolutely. And I don't think it's just legal. I think it impacts all other departments too, that either serve as the hospital or serve as the company.
True. When you talk about your business specifically, which is, you know, management services organization, a physician group partnership that you have in place, when you think about how compliance can be a strategic partner within your organization, or at least within the leadership, having that communication on how that person or how that program can be a strategic partnership, how do you address that with them?
Since we are a company that is comprised of physician groups, and we are continuously looking to expand and partner with new physician groups, one of the selling points in terms of compliance and being a strategic partner is to assist in growth. Okay. As I mentioned when we were talking about the other question, there are many groups that don't have compliance departments. They're smaller. And as a strategic partner, I want our CEO to have the discussions of, listen, you want a compliance program that is expandable with the size of your organization. And when you bring on new groups, you can easily implement that compliance department within the groups that may not have it. So it really is a strategic advantage to have it in place, have a robust program, because then it saves you time. Well, not only during diligence are you able to discover issues, but then you implement that program across the new groups quickly and efficiently.
Yeah, a fully scalable compliance program doesn't mean as you grow, your compliance program necessarily needs to grow either, right? If it has the right processes in place. So you guys bring in compliance to talk strategically how you're going to grow, and also kind of the M&A work that you're bringing in, so making sure you're not bringing in, I'll quote it, bad actors, but I'm not necessarily, not everybody's a bad actor that just doesn't know it. But so you bring them in on diligence, you bring them in to know what you're getting, so there's not a risk there. And then you also sit down with them and talk with them about the growth potential.
Right. Okay. Yes. And we were just at the Nashville Transactions Conference, and there was a lot of talk about strategic growth and compliance and what you do to grow. And so many discussions were centered around your presentation as well. When you do diligence and you discover these compliance issues, whether it's auditing or other things that have happened, that may derail a deal. It could be costly either on the front end or once they are part of your organization. So you really want to have a grasp of the potential issues. And that's where compliance comes in. You need to discover those issues so then you can either address them or take the risk going forward.
When you guys are doing diligence, because I think this is important for leadership to understand, because a lot of times I hear, okay, now it's time for compliance diligence, and it may be after legal diligence, maybe after financial diligence, maybe everywhere. Do you guys have a conversation about that to say, I think we need to do this first so that we don't spend a lot of time and money on all the other things, because compliance can put a hole in a deal pretty
Yes.
quickly.
Yeah, I can tell you one of the very first things that we do is a discovery audit.
Yep. Oh, good.
Yeah, but before we get to it, it kind of goes hand in hand with financial diligence and legal diligence. Those are the three main work streams. And legal diligence includes a lot of the regulatory diligence. So those things really do go first. And if there is a major issue, there is a discussion to address it. And then depending on how the audit comes back, then there's a different discussion. It is on the forefront of our diligence process.
And I'd imagine once you get close to a close, you have that conversation with your compliance program too about how to implement the current program at the new one.
Absolutely. Yes. We have an integration plan that includes incorporating the new physician group into our exclusion checks and auditing cadence and distributing the hotline and just having the discussions with the leadership team of this is what we have. This is what we want you to market to your physician so they are aware of what's going on, and training. And so all the elements that will be implemented post-transaction.
I'm sure that makes, once you're dealing with it up front within a new group that's coming on, as opposed to surprising them later, right?
Absolutely.
You're like, hey, this is what's going to happen. This is what you're going to be a part of. A lot of them may push back at first, but they really appreciate being part of a bigger thing, right?
Yes. And many times during diligence, the response is, we rely on the hospitals for a compliance program, whether it's exclusion checks and policies, procedures. And we haven't really had much pushback saying to the group, we have our own program. So post-transaction, you will fall under our compliance program, and we can tell the hospital, we got this, and we're going to implement all the elements.
This episode of the Compliance Advantage podcast is brought to you by Ronan Healthcare Compliance. At Ronan Healthcare Compliance, we believe in transforming healthcare compliance from a checkbox attitude to a strategic advantage. With decades of expertise, our team of consultants provides innovative solutions tailored to your organization's unique needs. We don't just help you meet your standards. We elevate your business, ensuring ethical practices are at the heart of what you do. Whether you're navigating complex regulations or seeking to enhance your compliance strategy, Ronan Healthcare Compliance is your partner in achieving excellence in healthcare compliance. Ronan Healthcare Compliance, redefining compliance, empowering leadership. Visit us at ronanhc.com to learn more. Now, back to the show.
Since our last presentation or since our last podcast, any big aha moments when it comes to compliance that you've discovered and you're like, oh, that was great that we had that, or, oh, great, that's a learning opportunity for me?
Well, aha moments. I don't know if this is necessarily an aha moment, but more and more I realize how pervasive compliance is. And we touched on it with the first question. Essentially, every discussion that I have within the organization, one of the questions is, we need to bring in compliance, whether it's our CM process with the changing coding guidelines or auditing or billing issues. Compliance has to be involved. Financial, we build pro formas for clients. Well, compliance should be involved, and legal, because you can have potential regulatory issues with regards to compensation going back and forth. Operations, things in the field, dealing with EMTALA, dealing with all kinds of regulatory issues or patient concerns, things like that. Compliance is involved. Legal, of course, compliance is involved. So it touches every department. And I think I'm realizing it more and more the more we expand how much compliance is just involved in everything and how many things can go wrong.
Well, I mean, it starts with the culture of compliance, right?
Right.
And I think we were talking about something the other day, and someone asked me, how can you kind of guide a executive leadership CEO to say, this is what the size of your compliance program should be. This is what it is, right? And how can it be cost effective and still be effective within an organization without breaking the bank, right? And I
Right.
think, part of my answer was, look, human resource is not necessarily the thing that you need in compliance. What you need is good leadership, good people to support, or a good person to support, if you will, and then just really good processes within the organization that allows the company and its leadership, whether it's human resources, the CEO, the COO, whoever, to lead with compliance, right? So
Right.
they may not know the specific, intricacies of it. And that's where you got to have your compliance executive a part of the discussion. But at the end of the day, you really want that whole pervasive culture to be, okay, this is what we're going to do. Let's make sure we have compliance here as well.
Yes. And I like that you said culture of compliance. I also like the saying of let's not be a culture of silence, because a functional compliance program has issues, and those issues are discovered and reported. You don't want to create a culture of silence where you don't discover anything, and then what are you fixing within the organization? So I think we touched on it on our last podcast. What you want is people to feel comfortable to call the hotline or come to the compliance officer and say, I think we have an issue, and we address it. And we've actually noticed throughout the years that our contacts are increasing.
Great.
We are advertising our hotline, and our compliance officer has been a lot more involved in operations. They know who to reach out to when there's an issue. Before, they used to go to legal. Now they go to compliance with compliance issues. And we've seen an uptick in compliance contacts, which is great. That's what you want.
It's so funny you're talking about bringing compliance in as a partner for a lot of conversations that different departments will have. And I was just having a conversation with a board member the other day, just a touch base. And she said, finance did this thing that had some ramifications later on that were compliance ramifications. And she's like, I thought we were at the point where compliance would be sitting beside them when they're talking about doing a big thing, a big change or whatever it may be. And they just weren't. And now it becomes a reactive type of tool versus something you could have prevented in the long run. So I really like the fact that you're like, we bring them in, even if they're just sitting there to go, this one may not be, let's look out for this area. Yes, you can, but let's talk about how we get there.
Right.
So great. Moving on to we're in this little interesting regulatory environment these days. And I get a lot of questions from our boards and our CEOs to say, how do we address the regulatory issues that are going on today? And a lot of what I say is go back to time of COVID, right? Where there was a lot of relaxation of some regulations. And we won't call it the wild, wild west, but you could probably say that there was a lot of people doing a lot of things that they probably shouldn't have been doing. And I think we're kind of in that same type of regulatory environment with the new administration, looking at how enforcement actions, and they're putting their own spin on it. One of the things that I continually say is don't take our eye off the ball. We need to keep doing what we're doing. And this is the time actually to be the most proactive that we can be, because we're not having to be so reactive on different audits or investigations that are going on. So I'm like, this is the time where we need to start that. So when we talk about compliance as a superhero and a superpower with this new regulatory environment that we're facing and how it's changing, what do you think the best superpower would be for a compliance program?
Oh boy. Can I do two?
You can do as many as you want to.
Okay. So one of them, I would say foresight, being able to read minds of our regulators, get in the mind of CMS, Department of Justice, the OIG, and see what their plan is going forward so that we can plan ahead and get ahead of whatever's coming. I'm going to use a soccer analogy that my daughter, we're in soccer season. So don't look at where the ball is, look where it's going.
Yep.
And if I could read the minds of what changes in coding guidelines are coming down the road, it would be great. And the second one, kind of more internal, and it kind of ties everything together that we talked about, is art of persuasion. Man, it would be very easy to implement successful compliance departments and get what you want when you can persuade and sell it to every executive within the organization. And they're fully on board. Yes, we're doing this. This is great. I don't care how much it costs. That's stretching it a little bit.
I've never heard that before, but okay.
But that would be great. Just being able to persuade everyone to believe in compliance and treat it as a strategic partner.
Oh, it's funny you say that, because the art of persuasion is a great superpower. And I think that
it's a book too.
It is. But I like it in this context. I had someone tell me the other day that she was actually referring to me, and she's like, look, I've kind of dealt with a lot of different compliance people and compliance officers, but you have a way of just not necessarily selling this thing. She actually said BSing, but she's like, this is really not BSing, but you just have a way of making people go, yes, that's what we should do, or yes, where we should be at. And I think a lot of compliance leaders and compliance officers who have not really transitioned into that compliance executive type of role really miss that art of persuasion. And I think that's a really interesting perception on your part to say, how do we start, making, and as leaders, as CEOs and as boards, I think you need to look for those people that are compliance executives who understand the art of persuasion.
Yeah. And I would also call it leadership, being a leader that's understanding of the needs of the company and guiding his or her people in a way where you understand their challenges, and you're kind of what you said, you have this way of explaining things that makes sense, and you know your audience. So that kind of goes together with art of persuasion.
Yeah, I think not using scare tactics or making people feel afraid, and just saying, understand these things happen, and this is how we need to deal with them, and this is how we need to get through them.
Exactly.
Given your responsibilities and your dual role over general counsel and over compliance, and not necessarily dual roles, but dual responsibility, we'll put it that way. What's kind of the best piece of advice that you would give CEOs or board members or executive leadership in a healthcare organization about how to, utilize compliance or utilize their compliance officer, or really make it at strategic advantage?
I would say find yourself a compliance officer that is an innovator and a strategic partner. You can find compliance officers who know the rules inside and out. But if they cannot apply those rules to your company and your growth strategy, they won't be very successful or helpful to your plan. So you want a compliance officer that knows your business in and out and applies the rules to help you grow or expand or be successful in any way. You may not want to grow, but any goal that your company has, you want a compliance officer to take those rules and help you achieve them.
Love that. Ties into everything we talked about, I think, today, which is be persuasive, also be proactive, really understand the business, and really sit down with the rest of the departments and the rest of the colleagues that they have, whether it's legal, human resources, operations, and really be that partner for the company. And when the executive team leaves them out because maybe your compliance executive isn't the right person, or they're the person that's, just really regulatory based, can't see outside of that, and say, hammer looking for a nail, those are really the people that really taint the perception of compliance and people shying away. So,
yes.
All right. Last question. What do you do to take care of yourself? Health is wealth. You talked a little bit about it with your book, and I really enjoyed that. So your five pillars, or your five areas of wealth. What do you do to take care of yourself?
Well, Do you want the honest answer or do you
No,
want the
lie to me. I
professional?
like it.
So I mentioned health and focused on health at the beginning of our conversation. It's been a hard couple months, 3 months to be exact. Breaking a shoulder really derails everything that you had planned. So it really puts things into perspective that when you don't have health, it's really hard to do everything else. Work is impacted because of your recovery and PT appointments and pain. And so what I've been doing for the last few months is focusing on healing my shoulder. Lots of physical therapy. It has taken a mental toll a little bit because
Sure.
it's not healing as fast as it should, but we're getting there. So the one advice I give to everyone, focus on your health, take time to exercise and eat healthy and be better, because it really impacts everything else when you don't have that.
It does. And it's interesting you say physical therapy, because there's so many other types of things that you can do for your health just to keep you on the right track, especially the older that you get. And breaking a shoulder is not a minor thing. So
I thought it was.
I'm happy that you're recovering and you still have it and you're not in a sling or something of that nature. We started having people stretch us there's a lot of different franchise locations out there, different types of companies, but a lot of people don't necessarily think that I can work out, I can exercise and get on the treadmill, I can eat right, I can do all these things. But physical therapy, stretch, other things that are kind of augmenting what you're doing can really help that health and well-being and recovery too, I'm sure.
I'm a big fan of needling these days.
Okay. Yep.
It's not necessarily pleasant, but it's wonderful.
Yes, I fully appreciate that. I did some cupping one time, and I hate it. Absolutely hate it. I will never do it.
I'd like to try that. I haven't tried it yet. So.
I don't like things like stuck on my skin and for long periods of time. So it was that and acupuncture. I cannot do it.
Then you probably wouldn't like needling.
I probably would not.
And then they connect you to an electric current.
Yes,
they
did that to me for acupuncture, and I am not doing that ever again.
I do it twice a week.
So. See, I understand. People love it. It's just not for everybody.
Yes,
so
I get it.
Well, Basia, thank you so much for your time today. Really appreciate it. It's always great having you back on the podcast, and good luck to you. I think you're doing great things, and hopefully your shoulder recovers.
Thank you. It was a pleasure being with you.
All right. Thanks, Basia.
Thanks.
Thank you for listening to today's episode of the Compliance Advantage podcast. If you enjoyed it, please rate, review, and share this episode with someone who might benefit from it. Don't forget to visit us at ronanhc.com for more resources and connect with us on social media for the latest updates. And remember, compliance pays dividends. Invest today.